Alrighty, guys, welcome. On behalf of the Florida Department of Health in Volusia County, welcome to the 2021 Path for Hope Virtual Summit. My name is Jordan Holly. I'll be facilitating the session today. You have joined the session titled Opioid Impacted Family Support Program, Paraprofessional Training Orientation. All participants will be muted during the session. We will have a question and answer time at the end of the session if you do have any questions. You may raise your hand using the reactions button. It'll be at the bottom of your screen. We'll then call on you and allow you to unmute yourself. You may also submit any questions during the presentation in the chat box, and we'll pose them to the presenter at the end of the session if time allows. Thank you to the Path for Hope Summit Planning Committee partners, Advent Health, Community Coalition Alliance, One Voice for Volusia, SMA Healthcare, and the Volusia Recovery Alliance. It is my pleasure to introduce your presenters for the session, Elisha Gumataotao, and I'm sorry if I pronounced that wrong. She serves as the project coordinator for the Health Resources and Services Administration grant-funded opioid impacted family support program at LSF Health Systems. Elisha believes in helping people through workforce-based adult learning. She aims to train adults who are currently in or entering the behavioral health field. And Elisha has experience in developing onboarding trainings and orientations for new staff. Her focus over 10 years has primarily served individuals with dual diagnosis, individuals with intellectual, developmental, and physical disabilities, as well as behavioral challenges. Through her professional experience, combined with personal lived experience through close family, Elisha has compassion to work with individuals and family members affected by mental health and substance misuse. Welcome, Elisha.
Hi, Jordan. Thank you. And thank you everyone for joining us this afternoon. I also want to give thanks to Path for Hope for putting together this summit and all of the great information that is shared amongst the 3 days that we are with you guys. I want to take a few minutes to just introduce myself a little bit more. My name is Elisha Gumataotao, and I'm honored to be part of the LSF Health Systems as the project coordinator for our Opioid Impacted Family Support Training Program, also known as our OIFSP program. The OIFSP program is a Health Resource and Service Administration grant that's funded program that we were awarded due to our innovative approach to training peer support specialists and our prior successes with HRSA-funded training programs. This grant is in fact our third grant awarded from HRSA to specifically train peer specialists that play a critical role as part of our outreach and treatment teams within our system of care. Our peer training program is one of the innovations at LSF Health Systems that we are so proud of. To date, we have trained more than 300 peers across our region, and we are grateful to the Florida Department of Children and Families for their leadership in promoting and supporting peer support specialists as part of the recovery-oriented system of care, our provider organizations who work with us to serve as learning and future employment sites for our students, and of course, our funders, sponsors, and donors who make it all possible. Peers are individuals who share their lived experience to connect and relate with others who are on their own recovery journey. This field is near and dear to me as I am a family peer. Before entering the behavioral health field professionally 13 years ago, I connected with it while helping my dad, a veteran, law enforcement officer, wonderful father and grandfather, navigate his own struggles. Unfortunately, I lost my dad in July of 2013, but the lived experience, compassion, and empathy that I gained from him allows me to help others and meet them where they are in their journey. His story is now a part of my story, and it always reminds me to think outside of the box, listen, and support a person where they are. As a project coordinator, I personally believe my lived experience helps me view goals and objectives from a unique angle. When designing innovations around our peer training program, our team looked at the trainings that are evidence-based. We asked and listened to the needs in the community and what trainings people are looking for. We researched how the trainings we provided could help people in recovery and enhance professional development to impact the growth of the behavioral health field. This is where innovation, creativity, compassion, support, and knowledge come together to help us make the greatest impact in the communities we serve and in the lives of children and families throughout our region. Today, I would like to talk to you more about peer support, a full circle of experience, education, and empowerment. At this time, I'm going to share a PowerPoint with you all. Jordan is going to kind of take control of my chat. So if you have any questions, please feel free to enter them in the chat, and then we will discuss them and answer them at the end of the presentation. Let me just switch screens. So as I mentioned, the program that I am overseeing currently is the Opioid Impacted Family Support Program, which is OIFSP. It is a paraprofessional training orientation. For those that do not know, LSF Health Systems is the not-for-profit behavioral health managing entity contracted by the Florida Department of Children and Families to serve a 23-county region over Northeast and North Central Florida. LSF Health System promotes and supports the development of holistic, innovative, and evidence-based programs within a strength-based, recovery-oriented system of care. The next slide shows the regions that we cover. Over here is the outline of Florida, and in this area is the area that is covered through LSF. That area is then divided into 5 different circuits. Circuit 7 is where most of you guys are, so Flagler, Volusia, Putnam, and St. John's. The 4th circuit is where Duval, Nassau, and Clay County are, and that is where I'm actually at, is in Duval County for Jacksonville. And then we also have our 3rd circuit, our 8th circuit, and our 5th circuit, consisting of Marion County, Alachua County, Suwannee, Columbia County, and the others that are listed here to make up 23 counties. At this time, we're going to share a quick Zoom poll, and I just want to kind of know who my audience is. So in just a second, everyone should see a Zoom poll pop up on your screen. And if you would just take a few seconds to answer that, I would greatly appreciate it. I'd like to know what your role is currently. If you are a peer support specialist, either certified or not certified, but working towards it, a case manager, a director or supervisor, community advocate, or other.
And then Elisha, if it's possible, the screen looks very small, the slide. Are you able to do it in like the full screen mode?
Yes, I can. Let me fix that for you. Thank you for letting me know, Jordan.
Absolutely.
All right, perfect. So it looks like we have our poll answered, and we have a peer support specialist online with us, and then we have some other roles, so that's exciting. I'll share that real quick with you. All right. Let me fix our screen here. So those that answered other in the chat, do you mind please typing in what your current role is? That would be great to know. And Jordan, if you can let me know if that screen is a little bit bigger.
That screen looks awesome. Thank you.
Perfect. Thank you.
And we do have Marisol, who is a health data analyst.
Right. Right. Thank you and welcome, Marisol. All right, so as I mentioned again, I want to really talk about peer support specialists, a full circle with experience, education, and empowerment. This means a lot to me because when we are talking about our peer support specialists, we're bringing in their lived experience, adding education through our trainings, and then empowering them to connect with other individuals as they navigate their own journey to recovery. At this time, I'm going to play a short orientation video that we use in our program. I thought it would be really great for you guys to actually see that as well, so you can understand the flow of our program and what is delivered in that.
We had another person put in the chat, Alexandria is part of Broward OD2A staff assistant at Florida Department of Health in Broward.
That's great, thank you. And if there is any audio problems with the link, if everyone would just type that in the chat, and then Jordan, if you'll let me know from your end.
Welcome to LSF Health Systems Training Program for Certified Recovery Peer Specialists. I'm Dr. Christine Caulfield, and I'm so privileged to serve as the CEO of LSF Health Systems. Thank you for being a part of this important revolution in the ongoing battle against the substance abuse and mental health epidemic that has devastated so many communities across our state and nation. More than a decade ago, LSF Health Systems first saw the promise of using peer specialists as part of integrated teams that could help those living with substance abuse disorders and mental health issues in all stages of their recovery. We have remained on the cutting edge of this promising innovation. This video provides an overview of LSF Health System's unique process for training and coaching peer specialists as they prepare for state certification in Florida. It will give you a brief preview of our face-to-face classroom trainings, RAP, and Helping Others Heal. Together, these programs provide a powerful foundation that peer specialists can build upon throughout their service.
I think what makes a good peer specialist is someone who is willing to consider possibilities that maybe they wouldn't have used themselves.
If you can't listen to what somebody's trying to explain to you, then what good's it gonna do?
When I was asked to, if I would ever work in recovery, I didn't understand where I was yet. Living a program of sobriety, I understand, my purpose in the world now is to help others. So working in recovery, I thought would be the best way to get spiritual affirmation by working with people and helping others.
I would say the number of peers that I have on my team, they each have their own individual unique personality. If you're an introvert or an extrovert, it doesn't really matter. They just need to be able to communicate and have the conversation and be willing to help somebody. That's the essential keys that happens with peer specialists.
The way LSF has put this program together is beautiful. They have taken the peer specialist training, the Helping Others Heal, the Wellness Recovery Action Planning, put them all together with an introduction, and key factor here, a success coach that kind of ties all those trainings together and is like your own personal cheerleader on your journey.
Just be. Everything will fall into place. All the tools are there for us to learn. There's open room for discussion. I didn't know what to expect when I started the training. Every morning we started off to be present. And that kind of helped us to know that everything outside doesn't need to be brought in, but we can't always leave everything out. So there's also room to address our own feelings and emotions, because that's what made us do what we did and make us not feel comfortable with ourselves to suffer from our illnesses of addiction or mental illness.
My advice for somebody who's beginning their certification training as a peer recovery specialist would be to become knowledgeable about what RAP services are, and then really understand the role of a peer specialist. Peer specialists are not case managers. They are not care coordinators. They're not clinicians. They are their own unique role that can be implemented into any level of care for a client.
Being open-minded in this training is important, because you come into this training with certain ideas and beliefs about what society and institutions have taught you, and this training gives you a whole nother perspective. So it's person-driven rather than being driven by the clinician or the peer specialist. It's driven by the individual that we're serving.
We aren't telling others what to do, and that is a big no-no. That it's holding their hand and guiding them on what their journey is, what their path should be.
I would advise that they come in open-minded. The instructors are excellent, in my opinion, and try to pay attention and follow through with what they're teaching.
I think our peer specialists coming into the Helping Others Heal training should expect their minds to be blown.
RAP stands for Wellness Recovery Action Plan, and it's really a tool that I use in recovery and that other people use to maintain their recovery. The idea behind RAP and where it came from is really, what is it that people use daily to continue and maintain their wellness? And when a crisis happens, how do they respond to that, and how do they make sure that they have all the support they need during a crisis? And it's really putting people in the driver's seat of their own wellness. And for me, what that's meant is I'm able to keep track of my sleep and what I eat and my socializing and my work, and RAP helps me do that. It's a plan for maintaining my wellness, which includes my mental health. The difference between a good RAP plan and then one that isn't effective would be the honesty that someone brings to the writing of the plan. So if I'm not honest with myself about how my life has gotten difficult and then how I responded and what kinds of help I really need, then I haven't got on paper what it is that I can do to help myself the next time it happens.
Helping Others Heal teaches our peer specialists how to work with individuals suffering or struggling with mental health or substance use disorder. Our primary goal is person-centered thinking. We also teach different pathways to recovery. We want our peers to know that there's not only one path to recovery, that there's many options to these peer clients receiving recovery. We also use a trauma-informed care approach, and we teach our peers cultural competency. We teach whole health and wellness. We teach ethics and boundaries, and we teach documentation as well. We want to empower our peers to be the best peer specialists that they can be in this field.
I think one of the biggest rewards that peers experience is success, client success. When they get that individual into recovery, when they get that individual just to detox into the inpatient facility, when a client has a negative drug screen, when an individual comes to their first 12-step meeting and takes a white chip.
At this stage, I'm excited about helping others know that there's hope in recovery. Watching the light come on in someone's eyes, it keeps me in mind of the butterfly effect, that the little things we do have a greater impact later.
As I look back at it now, it's something I dearly wish would have happened to me.
To use those experiences to help others instead of it just be my own personal thing that I keep hidden away or I'm ashamed of, that I'm able to be proud of it and have it help others.
It's the relationships. And I think that's what matters, is when we feel supported in our journey and when we feel like somebody's rooting for us along the way. it makes us want to do better. It makes us want to strive for more in our own lives. And I've been grateful to be able to be in a position to give that support, but they've also provided that support to me.
I had a client who was in one of our residential programs who relapsed, and she found herself overdosed in the bathroom at a pharmacy in Gainesville and was picked up and taken to the hospital. As soon as she hit the floor in the ED, we were notified. And I was able to deploy one of my peer specialists who found this client sitting in her emergency room bed with the blanket over her head, and she recognized his voice. He was able to bring her back to reality and identify, no, this is your recovery and this happens, and we're going to get you back to where you need to be.
I hope you enjoy your training, and I thank you again for helping us in our work to help transform lives and build healthier, happier, and hope-filled tomorrows.
All right. Thank you everyone for taking the time to watch that video with us. I've watched that video several times throughout the past couple of years, and it never gets old to me to hear the stories, to listen to the impact that our training program is having, not only on the peers that we train and that we work with, but also the community and the organizations that you all are a part of as well. Now to continue on with our program. Let me get this up. It's not sharing. All right, give me just a second, please. Thank you.
Being open-minded in this training is important.
Jordan, can you let me know what is coming on the screen share when I share for you guys what you are seeing?
Yeah. I'm seeing like your PowerPoint, and it says LSF Health Systems Support Orientation, and it's got like a link and your logo.
Okay, perfect. All right, so let me, I don't know why it's not coming up on my end. All right, give me just a second, I apologize. Okay, is it still the big screen?
Yep, it's the big screen.
Perfect. All right, thank you. Thank you everyone for your patience and understanding as well. So today for our objectives, I want to talk to you about our OIFSP project goals, as well as the difference between a CRPS, which is our Certified Recovery Peer Specialist, and a CRSS, which is a Certified Recovery Support Specialist. The CRPS is a paraprofessional that we have been focused on training on for over the past 4 years. However, CRSS is a new training paraprofessional that we are training this year on. And then I want to talk to you a little bit about the training and the certification process. For the OIFSP training program, We have partnered with provider agencies in Northeast Florida to expand the number of peer support specialists working in integrated interprofessional teams that are providing services to children whose parents are impacted by the opioid use and other substance use disorders. During our 4 years of this project, we plan to train about 132 students over 4 years and offer 2 paraprofessional tracks, CRPS and CRSS. When we look at a certified recovery peer specialist, this credential is for people who use their lived experience and skills that are learned in training to help others achieve and maintain recovery and wellness from mental health and/or substance use conditions. There are 4 endorsements that one person can apply for. You have a CRPS-A, which is adult, so you are testing to personal lived experience. A CRPS-F, which is for family, where you have helped someone in your family close to you navigate the system, as well as a CRPS-V, which is for veterans, so any person who has served in our U.S. Armed Forces. And there's also a youth credential. For the youth credential, you do have to be below the age of 26, and you are working with the youth and connecting with them either in schools or possibly other programs. The CRPS credential designates competency in the domains of recovery support, advocacy, mentoring, and professional responsibilities. All of these domains are covered within our training program, and it also includes additional endorsements to demonstrate the certified professional's lived experience. So that is really learning to tell your story, to be comfortable in telling your story and knowing what parts to share of your story to help the person that you are working with. The CRPS credential is recognized and is a billable service through Florida State's Medicaid plan as well. And applicants must hold at least a high school diploma or a GED to be able to start the process in becoming a board certified recovery peer specialist. When we look at a certified recovery support specialist, this credential is for people who work side by side with clinical staff to provide recovery support services to individuals with substance use conditions. CRSS applicants may or may not have lived experience as a person in recovery. This is one of the biggest differences between a certified recovery peer support specialist and a certified recovery support specialist, is that a CRSS may or may not have personal lived experience. It's also very useful training and credential for those who are working in the field of addiction and at a supportive capacity. So any person that may be administrative, technical, or even clinical can apply and take the training for a CRSS. This one also designates competency in the domains of recovery management, practical living skills, social development, resource linkage and follow-up, re-engagement, crisis support, as well as safety and professional responsibilities. Again, the bare minimum to apply for a CRSS is that you have to have a minimum of a high school diploma or a GED, and then you're able to continue with the trainings that are offered through the training program. When we look at CRPS certifications through the Florida Certification Board, that requires that the individual complete the required trainings. And that is where our training program really comes in. So we have designed the training program around the trainings that are required, as well as enhancement trainings to really give you the best opportunity to provide peer support services. You do have to have 500 hours of either volunteer and or work experience in the field. You do have to pass a level 2 background check. And then there is a Florida Certification Board exam as well. When we look at all of these requirements for FCB certification, our program supports peer students that are coming in to complete the required trainings. We help with connecting you to organizations that are either volunteering or hiring peer support specialists. If passing a level 2 background check is a barrier, we do have supports that will be able to help you guide you through that process, as well as study group exams, prep meetings via Zoom with our success coordinator as well. So we really tie in all of these to make sure that you are successful at the end of your training. For a CRSS, you do have to complete the required trainings. They have 1,000 hours of volunteer and or work experience, again, passing a level 2 background check and passing the Florida Certification Board exam. Through our program, we do have the success coordinator that is able to help and guide every student through all of these expectations for FCB certification. As we go into our program, we look for students that are able to commit to the program. We want students that are able to ensure client-directed care by assisting the client to build the specific skills and relationships needed to achieve and maintain recovery from substance abuse and or mental health. To complete the trainings outlined within our training program to prepare you to become a CRPS or CRSS. To complete field placement or an internship working with adults who have recognized mental health and or substance abuse disorder, as well as pursuing employment with working adults in the behavioral health field. With asking of a commitment of our students, we also provide a commitment to them. We ensure to our students that we are providing mentorship in a journey to become a CRPS or a CRSS. We are offering through our training program that you'll have the opportunity to participate in free trainings that are designed specifically to prepare you to enter the field. And through our training program, you will have access to support in your efforts to complete the certification process. One thing that is not listed on our screen is the network of peers that forms naturally within your training class or your training cohort. Because we serve 23 regions, post or prior to COVID, we were actually traveling to one of those areas to offer our training in a classroom-based setting. So with that, our students then connected with other organizations, agencies, other individuals that formed a peer network kind of in that area and really helped support throughout the training process. Currently now, due to COVID, we are offering our trainings virtually, and we have been doing that for the last 1.5 years. And it has been very successful in switching over from in-person trainings to virtual setting and trainings as well. As I spoke earlier, we have 2 paraprofessional tracks in our training program. We have the one which is our CRPS track as well as our CRSS track. Both tracks are 75 hours of peer certification courses. Again, 500 hours for CRPS, 1,000 hours for a CRSS, and that 500 or 1,000 hours is all volunteer or work experience. That does not include the 75 hours of education training. Again, personal lived experience. And then within our OIFSP training program, we actually have it designed to where participants will receive quarterly stipends upon completion of an outlined training requirement. In our OIFSP program, what makes it very unique and different from our past training programs is that we have a level 2 apprenticeship program. The apprenticeship runs for 12 months and it's operating in high need and high demand areas. At this time, for our apprenticeship program, we are focused in Circuit 4. So if you recall back to when I pulled up the map of where LSF covers, Circuit 4 consists of Duval County, Clay County, and Nassau County. To be a student in the Paraprofessional certificate track under the apprenticeship, there's an additional 1,000 hours of training, so a total of 2,000 hours of training that is completed through the 12-month apprenticeship program. There is also a quarterly stipend that is provided to students, and participation in level 2 is limited due to programmatic constraints. So we are focused at training 132 students over the 4 years in level 1. Half of those students will have the opportunity to move into level 2 as an apprentice and continue trainings and guidance of clinical staff. To be able to make that possible, we have partnering providers throughout Circuit 4 that we work with. We're working with Clay Behavioral Health Center, which is located in Clay County, providing a variety of behavioral health services, including substance abuse prevention, HIV services, children's mobile response teams, care coordination, and other family crisis support services. We also have Starting Point Behavioral Health Care in Nassau County that is providing mental health and substance abuse services to children, youth, adolescents, and adults. And Inspire to Rise, which is in Duval County, helping children, families, and individuals by offering comprehensive evidence-based services. Their mission is to inspire and treat individuals with substance abuse and mental health challenges, address the needs of poverty, reversing effects of trauma, breaking the cycle of child abuse and neglect, and strengthening families. All 3 partnering providers are focused in mental health and/or substance misuse, as well as other services that peer support specialists are able to come in and provide their services and help connecting with the individuals part of that program as well. A quick overview of our trainings for Certified Recovery Peer Specialists consists of WRAP training, which is Wellness Recovery Action Plan training. This is normally the very first training that we offer to our peers. And that is because when we want to start focusing on ourselves, developing a wellness plan, and then being able to teach and help others develop their own wellness plan. We also offer mental health first aid, cultural competency, question, persuade, refer, and our 5-day, 40-hour training, helping others heal. For our CRSS training students, they will have legal and professional responsibilities, re-engagement, crisis support and safety, resource linkage follow-up, practical living skills and social development, as well as recovery management. For our CRSS students, all of these courses are done online through a self-paced portal that individuals are able to log in, complete the trainings that are outlined for that time period, and then we'll meet with their success coordinator as a team or a group to review the information that was delivered. For our CRPS students, these are instructor-led Zoom trainings that we are now offering virtually. So these are instructor-led and scheduled versus CRSS, which you're able to do self-paced in an online portal. For those that need any contact information for myself, I have it on the screen. My email is elisha.gumataotao@lsfnet.org. My success specialist is Renee Morset at lsfnet.org. And for anyone that has any information or is wanting any information on our training programs, You may email peer.network@lsfnet.org. Okay, at this time, I will go ahead and open it to Jordan if you want to go with any questions that may have come into the chat.
Thank you so much, Elisha.
Absolutely.
At this time, you may anybody who has any questions may raise their hand using the reactions button at the bottom of the screen. We will then call on you and allow you to unmute yourself and ask your question. And we'll be alternating between questions that are entered in the chat and any raised hands. At this time, I do not see any questions in the chat. And I do not see any raised hands, but I do have a question. Are you guys still offering the CRSS trainings at this time too for open applications?
Yes, so actually what I'm going to do is share in the chat our training flyer. You guys are more than welcome to download and save the flyer. Within the flyer, there is an application link. You'll want to go through that and complete the application. Please feel free to share that amongst your contacts as well. Give me just a second and let me put that in there for you.
Thank you. Do we have any other questions? I'm not seeing any other questions. Well, I want to say thank you so much, Elisha, for sharing your expertise with us today. And thank you everybody for attending the session. There's going to be a link in the chat to complete an evaluation survey for this session. And a big thank you to the Florida State University for managing the summit evaluations. In order to go to your next summit, please visit your PDF or the pathforhope.com/summit 2021 and click on the link for the next preliminary session at 12:40.
And
Okay.
I almost have that the flyer up. Give me just
Awesome.
another second and then I'll make sure you guys have everything that you need.
I won't close out the meeting until that's been up.
Perfect. All right, so it should be uploading now. It is the LSF OIFSP training brochure. Again, inside of that brochure is the application link that you may click on, and it'll, sorry, my Alexa just started. It will guide you through the application process.
Awesome. Thank you so much.
Absolutely. And I hope everyone enjoys the rest of their afternoon.